Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Matthew Glenn of Topeka about ear infections. Thanks for being here today.
Thank you for having me.
What exactly is an ear infection?
Acute otitis media is defined as the first 3 weeks of inflammation of the middle ear space. It's typically associated with a middle ear fluid or effusion, and it's actually the most common reason that kids visit the doctor.
What are some of the symptoms?
It really depends on the age. At less than 2 years, children may have fever or irritability or just not eating well. Once we're older than 2 years of age, we'll have the fever and the ear pain. Most kids will actually pull at their ears as well. Once we get adults, they will have not only the ear pain, but most adults will tell you they're also having hearing loss associated with the middle ear effusion. We can diagnose this more readily when we do something called pneumatic otoscopy. That lets us look at the eardrum and show that it's red. And it can also help show that there is middle ear effusion present.
And how do you usually treat it?
It depends on the severity. Some ear infections can be self-limiting. If symptoms are not severe and lasting less than 3 days, then typically antipyretics or anti-inflammatories can be used. For more significant infections, we would add an oral antibiotic. Depending on the state of the patient, we can also perform something called tympanocentesis or a myringotomy to drain the middle ear space. For more severe infections or persistent infections, we can also place tympanostomy tubes. The tympanostomy tubes drain the middle ear space for a period of anywhere from 6 months to 2 years.
And how do you know at what point to call the doctor?
Again, it depends on the severity. If it appears to be a mild infection and self-limiting and it's lasting less than 3 days, then we can usually treat this without going to the physician. Longer than 3 days of symptoms require a doctor's visit.
Okay. Good information. Thanks for being here today.
Thank you very much.
Please join us next week for a new health topic discussion on House Calls.